People have eyelid surgery due to one of three reasons, generally speaking. The first reason is excess skin. As we grow older, the eyelid skin tends to grow in a downward direction following gravity. In the upper eyelid, what we see is skin beginning to grow towards the eyelashes, many times even touching the eyelashes and even impairing vision. So upper eyelid surgery, for example, removes this excess skin and restores the crease back in the upper eyelid so that the upper eyelid looks more youthful. Lower eyelid surgery is a little more complex because it not only deals with excess skin, but it also deals with fat that can begin to protrude forward and give the eye the appearance of having a bag. When this bag appears, many times it creates a shadow below and the eye begins to look tired. Additionally, the cheek tissues begin to descend as we grow older, and as those cheek tissues begin to descend, a hollow area begins to develop under the eye. So in the lower eyelid, it's usually a combination of one of those three factors. Typically, upper and lower eyelid surgery can be performed either under twilight anesthetic or under local anesthetic. Depending on the patient and depending on the problems, we can choose one or the other. If the procedure is performed under local anesthesia, it's very little discomfort. We usually numb the eyelids with lidocaine, which is very similar to what a dentist would use. And the numbing part of the procedure typically takes 3 to 5 minutes to perform. So there's a little bit of discomfort at the beginning, but then after that, patients typically don't feel any discomfort. If the prospect of having surgery around the eyes makes our patients too nervous and they don't think that they can be still throughout the procedure, then we choose the path of twilight anesthesia. Twilight anesthesia is typically provided through a IV, and it is done in a monitored setting. There is an anesthesia provider taking care of the anesthesia part of the procedure, and the procedure takes just as long as it would under local anesthetic, except the patient is completely unconscious. The recovery time for blepharoplasty is typically 7 days. All of the sutures come out at that time, and patients are usually presentable to be able to return back to work at that time.